Final member of our panel this morning is Monica Onyango, Clinical Assistant Professor of International Health at the BU School of Public Health. She is an expert on what are called CHEs, Complex Humanitarian Emergencies, and her work has taken her to South Sudan, Angola, Kenya, and elsewhere.
Thank you very much, and thank you for coming. My experience, I did not go to Haiti during the earthquake, but my experience has been in Africa, as you have seen, Sudan, Angola, and other countries in Africa. So by all respects, I've been a first responder. I've stayed there, I've opened, I've closed. And my experience with the reporters is almost nil. And that is because during the times when we started working in humanitarian relief, the first orientation is don't talk to reporters because they are going to misquote you. And I also come from a country where politicians are always saying, you know, the reporters misquoted me one way or the other. So it's very interesting that the field has moved so many years ahead, and now reporters are part and parcel of our work, and we need them in our daily work. So I thought what I'd do in my next 10 minutes is to really get the discussion, broaden the discussion a little bit, and talk about disaster in a broad sense and include other populations, other countries other than just Africa, Haiti, because we need to do that. And I always like starting with this slide because then it gets us to understand the magnitude of what we are dealing with in terms of disasters. Disaster as a word is very broad. It encompasses many events. Some of them are natural, as we've seen with earthquakes, and some of them are human-induced, war, etc. And in some of those countries where we respond, you find that populations are affected by natural disasters, but they're also affected by human-induced disasters, and we need to be able to understand how to, deal with that kind of situation and the kind of response which is necessary. So populations of concern which I wanted us to think about are both refugees and internally displaced. When we talk about disasters, like I've mentioned, armed conflict produces refugees, and it also produces internally displaced populations. Natural disasters also displaces people within their countries. So in terms of definition, a refugee is somebody who has crossed an international border, and the UN has a mandate to respond. Internally displaced populations are supposed to be taken care of by their own governments, as we saw in Haiti, but most of the time those governments cannot respond because the situation at hand is of such magnitude that they are not able to deal with it. So why do we care about disasters? And I guess the answer is very obvious. We care because we are human beings, and if other human beings are suffering, we need to respond. And in fact, the word humanitarian response in itself is about the ethics, the compassion, and just treating people as other human beings and telling ourselves that we need to be there when other people are suffering. So that is what humanitarian assistance is all about, and that is why we care. I wanted to remind us about the Rwanda genocide, which happened in 1994, and it was at a magnitude which tested the resilience of not just humanitarian workers, but us as a people and as an international community. Within 1 month, 1 million people had been killed, over 800,000 people had crossed the border. Humanitarian response, that is the time when we realized that we are actually not prepared to respond to populations of such magnitude. Within that month, 50,000 people had died because of diarrheal diseases, cholera, dysentery, etc. So we really need to think about responding in these situations in a more careful way. And Haiti, we've just had a lot of experiences. Pakistan has happened. And right now, we are talking about Japan, which is going on, natural disasters again, and some of the consequences of human-induced disasters, etc. So who responds in these situations? The United Nations response, international organizations, non-governmental organizations, and academic and research institutions. But we also have individuals responding, like you and me. If you're not affiliated with any organization, there is the temptation to want to go and do something. We are human beings, other human beings are suffering, and we need to be there. Now, this conference is happening here because we are an academic institution, and we also have research institutions within ourselves. So when we started responding in early 1990s, that's when I started working in relief situation. Academic institutions were not in the equation, and that is because disasters happened, there were quick things, there were people were displaced, we responded, and they were supposed to go back to where they came from. But that has proved not to be the same. We have situations where refugee camps has been around for over 7 years. We need to do something as people. Lessons have been learned, the best practices. We need academic institutions to be able to guide us, to do research, and to be able to normalize some of these responses. Individuals are responding, volunteers. What is the best time for a volunteer to go and respond in these kinds of situations? Do they need training? Don't they need training? What do we need to do in order to be able to respond? But even if you leave individuals alone, the fact that we are having this conference and you are going to see with the presentations of the day, it's almost a multidisciplinary response. It's no longer before when we responded and people only needed food, they needed shelter, which I'm going to talk about a little bit, but there's more which is needed in these kinds of response, and that's where academic and research institutions come in. In terms of public health response, we know what these people need. We have standards, and the SPHERE project is just one of the standards which is out there, which gives us indicators and what we need to do. So when you go to give shelter, we know how much shelter we are supposed to give to these people. We know what kinds of space is needed in the traditional way of response. They may be different when you are in Macedonia, when you're in Japan, when you are in Sudan, when you're in Haiti, depending on the resources and the people affected and what we are able to bring in within that time. Water and sanitation, we know that is a problem, and Haiti is just a very good example of a place where sanitation, if it's not managed well, can really go wrong, and we saw that with the cholera which came up and other problems which have come. But as public health response, we know what we need to do in terms of water and sanitation. We know somebody needs a minimum of 15 liters per day to be able to survive within that context. So we know all that. We know people need food and nutrition, and we also know that health services are very necessary, as we are going to see as we go along within the presentations of today. But there are also challenges which have come about over the years, and I wanted to talk about just 3 of them. Urbanization and disasters. There are no guidelines for urban humanitarian response. Haiti is a perfect example. Most of the people who have been displaced within urban communities, most of them, especially in developing countries, if you leave Japan away, they are slum dwellers. Slum dwellers are usually people who don't have any title deeds, they don't own land. So when they get displaced and we respond, number one, it's a challenge in terms of providing shelter. As humanitarian responders, we are used to providing shelter to large numbers of refugees or internally displaced populations. We are given space somewhere, and we take people there, and we put up tents, we put up semi-permanent houses. In an urban population, because of the density of population alone, we are not prepared to be able to respond to that situation. Number one, land is owned by somebody. So even if the government wanted to give us land, somebody has to pay for that land. Number two, when you talk about vulnerabilities, who is vulnerable? These people are already vulnerable before the disaster happens, in the sense that living in a slum in itself, as one of the urban settlements, it's already a humanitarian catastrophe waiting to happen if it's not already happening. Humanitarian assistance workers, as we are today, we are not trained to respond in that kind of situation. Are we going to raise money to buy land, or are we going to talk to the government? Kenya is a perfect example where we had post-election violence and people are still in IDP camps today. We have land, but land is owned by individuals. and the 1,000 of money from the government. So it becomes a very tricky situation in terms of resettling these people. The landlords themselves, they also become vulnerable because they have lost, their settlements. So those are situations we are not trained to do. When it comes to refugees, from 2007, according to UNHCR, urban refugees actually surpassed refugees who stay in the camps. How do we deal with them? Because most of these urban refugees settle in the slum areas. And how do we identify them? As I've mentioned, those slum areas, they're already stressed in terms of resources within those settlements. Then you bring in refugees who come to settle within those slums, it becomes very difficult. But what makes it very difficult is because we don't know who they are and we don't know how to identify them. We don't have mechanisms to do that. So those are some of the challenges we need to think about as we think about a response. Vulnerable populations, especially the elderly population. Japan is a country which is very, very well prepared, but still it has a very large proportion of its population who are the elderly. We need to start thinking about that. We are prepared to identify them, but to be able to deal with them in terms of the chronic ailments they have, in terms of the medications, and just the care which they need becomes a challenge. Professionalization of humanitarian assistance, that's a theme which has already begun coming up. Relief work, traditionally, we are used to it as quick in, quick out. Because as I mentioned earlier, people really never cared about relief work as a profession per se, because there are situations which are supposed to be temporary, but they are no longer temporary. In addition, NGOs who respond during relief, some people are prepared because they have had years of experience. Some people do not know one thing about what they are doing. So there is the discussion. We have courses like the one I lead at the School of Public Health, and there are many others around the world which are preparing people to work in relief situations. But we still have a large proportion of people who go to respond in relief situations who have no idea of what they are doing. So should we begin discussing how to professionalize? Do we need a professional organization or a professional association of humanitarian assistance? And where is this going to come from? If you come from Bangladesh, where natural disasters is a daily occurrence, are you going to accept somebody from the West coming to teach you about natural disasters in your country? So those are things we need to think about in terms of the changing nature of crisis. Conflict-driven disasters have become very long-term, almost never-ending, and humanitarian workers are really not trained to stay there, to design programs with those kinds of long-term issues which we deal with. Finally, I wanted to talk a little bit about local responders and in terms of the media and the role the media plays in acknowledging what the local responders and the local communities, so to speak, they're almost invisible in the reporting which we hear, and probably invisible is a very strong word, but humanitarian assistance or response to disasters has almost become an elitist kind of thing, because you find international people, before they arrive, there's actually no news. But when they arrive and they descend and they have all these gadgets and they have all those things going on, then there's news. But for example, in earthquake, the first 72 hours is most crucial. And the local responders, despite the fact that they don't have anything, they're usually the first people in the scene. And when they're there, the cameras really don't capture them. When the cameras go away, they still remain there. We still don't capture them. So we really need to do a good job at acknowledging the role of local responders to avoid the danger of having a single story. Because right now, the way the news is, we have a single story. And that single story of international community coming in and saving our lives. And it's good because we do a good job. And some of the examples we've seen by the previous presenters, there's really need for international community to come in, and we have other resources which local communities don't have. But within those local communities, we also have small heroes who do small things. And the media need to find a way, apart from being able to appeal to the American public so that they bring out dollars, we also need to appeal to the American public so that they're able to understand that there are other local heroes whom they actually could be supporting and are doing a very good job. So let's think about the other half, and the other half is the local responders, and try to avoid the danger of having a single story. In conclusion, in terms of going forward, I think by the end of the conference today, we are going to appreciate that actually to respond in a disaster is more and more a multidisciplinary approach. And there are areas which we are going to listen to, like crisis mapping. Those are things which were never there. Urban planning, those are things we are going to hear. So as opposed to before, when as a nurse, I only went there as a nurse, went with somebody who's going to do water, going to do food. Right now, I need to think of an urban planner, because if you are going to a place like Haiti, you need somebody to help you to think about unique requirements of shelter in those kinds of areas. The mass media, I think, is still going to be in the central of our response, and we need you to get the story out. Right now, when I'm responding, the first place I go to is CNN so that I see the summary, what's going on. So we are going to need the media, and I think all of us need to think of ways of, working together, making it more positive, and not getting public health professionals like us to fear the media because I'm going to be misquoted, but also to embrace the media because you get the story out and you help us also to gather data in the initial stages. Thank you.